Hello, mommies. It's Dr. Vigo, founder of Painless Pregnancy, coming to you today about breathing. Now, there's lots of ways that you can breathe, and we know that during pregnancy, breathing changes dramatically, right? And why is that? Because the belly grows a lot and encroaches on those ribs. That's definitely true, okay? The other thing we want our patients to understand is that your rib cage from up here to down here, the shape of that bone structure changes tremendously, okay? So if your ribs usually rest here, okay, and then during pregnancy they come out, and then you go to take a deep breath in, it doesn't have very far to go. Versus before you were pregnant, you would take a nice deep breath in and you had all this motion at your rib cage. So after pregnancy, we notice that this resting position can persist, and that will cause us to breathe paradoxically. What that means is instead of having a nice big rib cage movement when we breathe, we end up using some neck muscles here, and we come up like that, okay? So if you look at yourself in the mirror and you go to take a calm breath, and you notice that you're coming way up towards your chest, then that means you might still be in a pregnancy breathing pattern, okay? So if that's you, I want you to go ahead and find a quiet corner in your house and place your hands on your tummy. And when you breathe in, I want you to feel the tissue under your tummy soften. This does not mean that you're gonna push that belly out with the breath in, okay? We don't need to dramatize that situation at all. It's a softening of the tissues. It's accepting the space that your lungs start to take up as they fill with air. Okay, so your hands are on your tummy. You're gonna breathe in. Good. Now I want you to place your hands on the outside of your ribs. When you breathe in, you should notice your rib cage goes out to the side, and they come back together when you exhale, okay? When that happens, my tummy softens, and I can tell that my abdominal cavity is accepting the space of the air from my lungs. So one quick tip, you can assess yourself. Look in the mirror when you breathe. That's normal, okay? Not normal. You're doing too much with your neck, your rib cage is going up, your shoulders might go up. All of those paradoxical movements can cause changes to go on. Imagine, breathing is the foundation of every movement that we do. So if that foundational component is off, then all of your other movement patterns have potential to be off, okay? So I hope those strategies help. They're relaxing and they're also restoring of normal breathing patterns. Now, if you notice this is something hard for you to do, if you can't take a nice deep breath, if you feel short of breath when you know you shouldn't be, all of those things are reasons to call a women's health physical therapist. So we are happy to chat with you over the phone and see if we can help. We do free 10-minute consultations all the time. So please reach out and let us know what your questions, your concerns are, and we're happy to help. Thanks for watching.